Welcome back to Weekend Pulse. I'm Joey Hudson, your host. We appreciate you spending a few minutes of your Saturday with us on this afternoon, and it's not too late for you to join the conversation by calling 877-235-9405. That's 877-235-9405. Your calls are always welcome. And we'd ask you to like us on Facebook, follow us on Twitter at Talk945, and check out our website at conservativetalk945.com. We're all aware of the debate that we've had as a nation over the past few years about health care, and all kind of questions have been asked. What role should the government play at the federal, state, local levels? What's the responsibility of our employers? And of course, we have to ask ourselves, what's our responsibility to take care of ourselves? And it sometimes seems that the more questions we ask, the more questions that arise. But what is clear to me is that I personally cannot wait on the government or anyone else to take care of me. I have to be personally responsible for my own health, and so that's the reason that I am a member of an organization called PartnerMD, and I'm happy to have with me today Dr. Jack Durham. Welcome to the show.
Thank you.
And Melissa Gifford, who is the membership coordinator for PartnerMD. Welcome to the show. We appreciate you being with us. Dr. Durham, I know that you've been in practice in the Greenville area for a while now. You joined PartnerMD in January of 2013. Prior to that, you were with the Holly Tree Family Practice in Simpsonville. You also was part of the emergency medicine staff at St. Francis. Tell us why you chose PartnerMD, first of all, as a place for you to practice, and secondly, why you encourage your patients to be a part of PartnerMD.
Like a lot of physicians this day and age, we're overwhelmed with the numbers of patients that we have to see, and more you feel like you're not doing a good job or you're not being as complete as you should be, and not providing the care for the patients that they need and they deserve. Fortunately, I was in touch with PartnerMD several years ago when they were interested in building an office here in Greenville, and they gave me the opportunity to practice medicine the way I think it should be practiced. I spend 30 minutes with each of my patients for their regular visits, an hour and a half for physicals, and it really gives you the opportunity to know the patient, know their problems, and together formulate a plan to help them. It's really gratifying to be able to practice medicine the way I used to.
Well, and I think that's the key to it. And again, I am a member of PartnerMD, and I've got to say that Jim Burford has been my personal physician for many, many years. And I remember when Jim, before he joined PartnerMD, I sometimes, and it wasn't Jim's fault, but I sometimes would arrive at the office and wait for longer than it took him to see me. You know, I may wait for an hour and get to see him for 15 minutes. And that was simply because he had so many patients that he had to see. That's not the case at PartnerMD.
No, sir. The average physician has between 3,000 and 4,000 patients. We limit the number of patients we have to each physician to 600. So obviously we have more time to spend with the patients.
And that's the key there is being able to have time to develop that personal relationship. I know growing up, my doctor was the doctor who delivered me. He seemed like a family friend. We could call him anytime, but it seemed like medicine got away from that as lives got busier and we had more people move into the area. But with PartnerMD, it really is, you do build a relationship with your patient.
You certainly do. You get to know them as individuals. You know their children, you know the children's activities, you know their pets' names, you know everything about the family. And I've often told people that I have a group of patients that if I was working in the yard on a Saturday afternoon and they just pulled up in the driveway with a problem, I'd be happy to stop and see them.
Yeah. Now, Melissa, you're in charge of, let's just say, a membership coordinator. Is that
Correct.
A fair assessment there? So you give people tours of the office, you talk with them about the concept, and it's a relatively new concept to Greenville. So tell me, give me your elevator speech. What do you tell people when they come in for the first time who know absolutely nothing about PartnerMD?
Well, the first thing is that we give 24/7 access to a physician. So how many times does something happen on the weekend? You know, it's Saturday, you don't know what to do, you need your physician. You actually have a number to dial. We give you a card with your physician's information on it. You have a number to dial, and a physician, not an answering service, not a secretary, will answer the phone. And actually, Dr. Morse one time told a story that she answered the phone on the weekend, and someone said, "May I please speak with Dr. Morse?" And she goes, "Well, this is Dr. Morse, and this is a paying member." And they're like, "Oh, really?"
And what a surprise.
Exactly.
They did not expect to get the doctor, yes.
Exactly. So that's the first thing. Next, we give you Same day or next day appointments, 5 minutes or less wait time, 30 minutes with your physician, an hour and a half physical every year. And then what makes us different from everyone else that even does a membership type medical practice is our wellness side. We have Casey Edmonds, who is a wellness director. She is a graduated exercise physiologist with a 6-year degree from Furman. She absolutely, as you can attest to, she absolutely knows what she's doing. And she has a great time with the patients, and she sees them 4 times a year, which is the accountability and the preventative side of medicine.
Well, and Dr. Durham, that is an important part. So often we don't see you until it's time to treat symptoms or treat an illness. But if we spent a little more time on prevention, then we could spend less time on treatment.
Without question. In medical school, we're taught basically to diagnose and treat disease, but after a few years in practice, it becomes apparent that that's not where you should be putting your focus. You need to prevent disease. Working in the emergency room gave me a clear indication of that, because you see where health problems left unattended end up, and it doesn't have to happen that way.
So, Melissa, if someone is interested, and if you're just joining us, we have with us today Melissa Gifford and Dr. Durham, who is with the PartnerMD program here in Greenville. If someone is listening today and they're interested in coming over and talking with you, tell us the best way to reach you and the first step.
The first step is to give me a call. My number is 315-1340, and I can set up an appointment for you to come by, take a tour of the office, and sit down and visit with one of the physicians. If you go online to PartnerMD.com, you can click on Greenville and see our physicians' bios, so you can decide which physician you might like to sit down with. If you want to sit down with more than one physician to make up your mind, it's fine to do that as well. But you can talk to the physicians and then talk to me about the ins and outs of membership. And we want it to be the right thing for you to do. So come by the office, no pressure, no obligation. Just take a look and see if it's something you're interested in.
And if you can't remember those phone numbers of that website, just simply go to conservativetalk945.com, and we have a banner link on our website. Just click on it and it will take you directly to the PartnerMD website for that information. Now, I know the next question, Melissa, that people are going to have is, what does it cost? It sounds kind of exclusive, but it's affordable.
Absolutely. I like to say that people spend as much on coffee every month, on their cell phone every month, or their cable TV every month as it costs to become a member of PartnerMD. It's very affordable, and we do call it membership medicine because it's membership medicine for everyone.
And I think that is an important part of it, is because you are a member of this group. And again, it's like a family. I just came from there. This past week, I came to have some blood work done. I got my flu shot. I mean, I was in and out in no time. I never even got to sit in the waiting room because you ushered me straight to the back to get started. And that is such an important part to me because, everyone's time is valuable. And so it just really makes you feel good when you come in and you have James greeting you. You're already ready for us, and just take us straight back and do what we need to do. So PartnerMD is just a great place. Give us those phone numbers again.
It's 864-315-1340 is my direct line.
And just ask for Melissa, and Melissa can take care of everything you need. She can answer any questions. And I know one of the big questions, too, is, does insurance cover this?
Insurance will not pay for your fee. Your fee is an out-of-pocket expense. But once you are a member of PartnerMD, we take insurances just like any other office does. So we will take Medicare. A lot of people have that question because there are a lot of offices now that don't take Medicare. So we take Medicare, most HMOs, and most insurances.
Dr. Durham, one last thing for you. Being in the practice for a number of years, that you have patients that probably will ask you, why should I do this? What's your answer?
I think the key you mentioned earlier is, people need to take responsibility for their health, and the health is one of the most important things, if not the most important thing we have. And we provide the capability with Casey, with the lab work and the exams that we do, to help people be healthier. It's a matter of just having the time to spend with them and having the time to educate them on what they need to do. It's all preventative.
Yes, and that's an important part of it. So, Dr. Durham, Melissa Gifford, thank you both for being with us. PartnerMD, again, you can find that information on our website at conservativetalk945.com. Thanks for spending a few minutes of your time with us. So if you're ready to spend more time with your doctor than in the waiting room, if you'd like to talk directly to your doctor rather than a voicemail, or better yet, how many of you actually have your doctor's email address? If you're ready to get on the path to better wellness, PartnerMD is for you. Call Melissa Gifford today at 864-315-1340 or go to our website, conservativetalk945.com, and click on the PartnerMD banner for more information. After SRN News, Tony Lee will be joining us for a weekly Crime Stoppers update. We hope you'll stay with us. I'm Joey Hudson. This is Weekend Pulse on Conservative Talk 94.5 WGTK FM.
Somewhere I get